Okay, I just got live on Facebook and I'll be sharing the link in a while. It's loading. Okay, I just start like by introducing myself. So my name is Sadahid Nisar and I'm from the Faisalabad Hub in Pakistan. And our hub has started this initiative where we reach out to the various regions all around the globe, so we can connect to our hub, our fellow hubs, and get a more insight view about the current situations there regarding coronavirus. So yesterday I had a session with Region Africa and it was great. I had Lagos Hub, Cape Town Hub and Casablanca Hub with me. And yeah, I'm really looking forward to this conversation with both of you. So yeah, let's start. So Nali, would you like to introduce yourself first so the people get to know?
Yeah, sure. Thank you so much for the reaching out to all of us and doing this. That's great. This is Nali Ahmed from Erbil Hub Global Shapers. I'm sixth-stage medical student and a member of Global Shapers in Erbil.
Yes. Great. And Hamad, you please could you introduce yourself too?
Okay, so my name is Hamad Drai. I'm a physician in King Faisal Specialist Hospital in Riyadh, Saudi Arabia, and I specialize in neurology. I'm also from Riyadh Shapers Hub, and I'm glad to be part of this discussion.
Great. Okay, I have shared the link. Okay, so we are having today, I feel like, a more in-depth conversation about the virus itself because we have you both people from the medical sector here with me. So it's great. So I would like to start the conversation by knowing about the current situation in your country. Hamad, would you like to start the conversation about this?
So, so it all began in January, where it actually became a national or international effort to stop the spread of corona in different areas of the world. The current situation now, we have a curfew set up to stop any spread of the virus in between the citizens, as well as to have multiple systems being activated as led by different ministries, either Ministry of Finance, Ministry of Education, Ministry of Information Technology, and also Ministry of Health, of course, leading these efforts. We had different, I would say, decisive areas of conduct where we stopped international and national travel or transportation in between. And we also held any educational efforts in schools and turned it into a study from home and work from home efforts. Every decision that was made had a cascade of different aspects and different decisions to lead smoothly into a proper progression of precautions without hindering any efficient actions toward decreasing productivity and as well as hindering the economy. I would say that's an open statement. We'll talk about more about different things later on.
Yeah, okay, good to know about the current situation there. Hamad, could you tell, sorry, Nali, could you tell us about your current situation in Iraq?
Yeah, sure. So I'll be talking about the northern part of Iraq. That's the Kurdistan region, and that's the part where I'm from. Situation is so far under control in the region. Even though, as I said, WHO has recently defined the region to be in community transition. That's to say, local transmission of the virus is possible now without any previous history of travel for the people. Total number of cases is about 99. We had 2 new cases of today. and recovered patients are 27, and there are 2 dead cases. So that's the current situation. It's a national epidemic, an emergency alert in the region as well, and it's the country and the region is in curfew. There has been a lot of measures being taken to contain the spread of the virus.
Okay, great. You just said like it has been discovered that the virus can be within your region without any outsiders. Can you explain this a bit further?
Yes, yeah, sure. So as I said, there is a definition of WHO for the regions that there is the virus spread, and they have defined the region to be in community transition now. That's to say, there is local transmission of the virus from the people who carry the virus and who are asymptomatic, and that they can infect other people without even they know that they have the virus or the infection, even without any prior history of travel to an area that there is the virus, or to bringing back the virus from somewhere else. So people might infect each other even without knowing. So what the Ministry of Health is saying now and alerting the people is they are saying the virus is in every corner of the region. So that's how they are alerting the people.
Okay, all right. And can you tell me about how the government is tackling the current situation?
Yeah, sure. So we do highly appreciate the government measures because they start acting very early in the spread of the virus globally, and that's highly appreciated and can be an example for others. They imposed a curfew. They closed the roads between the cities. They closed schools, universities, pools, gyms, restaurants, and cafes are all closed now. Public gatherings are prohibited. Conferences and events are all cancelled. The airports is shut. They are shut down now, so there is no flying out and flying in. And what they have said recently is portable health teams that are going to the places that are still open. For example, the supermarkets, the groceries, the gas stations, and the bakeries. Those places which people need, and the pharmacies, they have portable teams. They are going there. They are taking samples from the people who are working there. So that's what they have done.
Okay, good to know. Hamad, you already mentioned some measures the government is taking on in your country. Can you further explain like what else they are doing and how it has been implemented?
Okay, so I'll just begin with the also the current numbers of corona that we have. We have about 700 or 800 as of today confirmed cases. About 30 have been recovered, alhamdulillah, and we have one mortality that happened yesterday, sadly, for a elderly Afghanistan resident. The efforts would be described as I like to always think of the efforts described in all countries in 3 different aspects. The first one being the communication, the second one being the decisiveness, and the third one being, let's say, more practical. So the communication is very important to start off with being very honest with the citizens and the people you're working with, the global communication as well. You need to have proper communications and honest communication. You also need to have proper channels of communication. So from our aspect, we had very clear communication from all aspects of government. We also had proper communication in between citizens, which held the responsibility to have responsible information being circulated. This occurred roughly around January, where we are started the journey of coronavirus globally together. So what happened with the channel communication was the Ministry of Health is very excellent when it comes to giving and supplementing good, easy to read resources. So it became the personal or the go-to person for all the citizens. We had proper documentation, easy to read pamphlets circulated online in all different languages of the world, so talking about minor to complex things about Corona. And as well as we had a spokesperson starting to take the lead with daily communication on live transmissions to everyone in Saudi and abroad as well, discussing the current situation, what we need to do, what would be the next step. But the streams of communication were activated. The Minister of Health himself is always continually speaking to citizens at least 3 to 4 times daily over social networks. And we have other governments and other public figures and individuals speaking continually on different channels, either doctors or professionals in the field of public health, infection control, and infectious diseases. In the area of preparedness, we had or decisiveness, we had proper decisions taken, alhamdulillah. Since the beginning of the outbreak in China, we had strict, decisive actions taken, from blocking any international flight from the outbreak areas, and some of the areas that were said to be, might have been spread by the outbreak, but did not have any confirmed cases. We had proper infection control measures in the airlines as well, to not let anyone pass without being fully covered, and as well as if a person had any symptoms or did come from an outbreak area, it would be automatically shuttled into one of the quarantine hotels or housings we set up, and would not leave until 14 days. We also have the third aspect, which is personalization. So one thing personal about Saudi is we have this bridge between Bahrain and Saudi Arabia, and that has millions of people coming back and forth. It was difficult to screen everyone and understand where everyone came from, especially that some people would travel abroad and then come back to Bahrain and then go back into Saudi. And that's difficult to track if they came from an outbreak area or not. So we had this drive-through screening method that you heard of maybe in the Singapore and or in South Korea, and also in the United States, being made in that bridge itself. So we would screen people, and whoever showed symptoms, whoever was from an outbreak area, they needed to be responsible and communicate their presence. And then those who communicated were shuttled into housing. Sadly, some people did not communicate well, and numbers began to rise. Those that did not communicate were found to be positive later on, and they already had people people already interacted with them. And as Nali said, they are not symptomatic, they're asymptomatic, they don't know. And most people, as of what the CDC is saying and the WHO is saying, they're not really symptomatic, they don't feel anything, they're just carrying it. And that's the issue that we're having. And then from then on, when we started to have numbers, we started to have strict implementation of rules. Since the last month, we closed all schools, we closed about 80% of government work, and now all of that is work from home. Private sector has also been encouraged to do the same. As for doctors and medical professionals, healthcare staff, they've been given all the resources that is needed. All government work is shuttled into the Ministry of Health to give them what they need. For example, the Ministry of Education gave all the schools, if needed, to be used by the Ministry of Health to shuttle anyone there for quarantine purposes or for healthcare purposes. Finally, I would say that there's also a cascade of events. So when we closed the schools, when we started the education from home initiative, we noticed that there were people that did not have proper technology or proper infrastructure to actually study from home or work from home. So the Ministry of Information Technology, they did an initiative where people would donate, or companies and private sector would donate some computers and supplies to be given to those who are less fortunate to have the infrastructure to study or to work from home. And with that, the also telecom companies gave free internet and free access to all those that are working in being educated from home. They also opened the channel, which is called Ilm, or education, and that screens live transmissions of classes. So you can just open your your TV, and you can get classes happening on, and you can study whatever you are in the world. Finally, of course, the Ministry of Finance did multiple meetings, one recently with the G20 that happened today, and they spoke about different areas of commitments and stabilizing the economy and the market in the coming few months. Internally, we had about 120 billion riyals being spent internally to kind of balance the private sector and the small to medium companies or enterprises to strive still under these harsh times. And I would also like to mention there was a good area of global citizenship where the King Salman donated $10 million to the World Health Organization, and that would help supply and strengthen the low socioeconomic, underdeveloped areas of the world that don't have proper healthcare systems to support themselves in order to report, to identify, and to manage these cases, if they are corona or not corona, to manage corona outside of the region.
Okay, it's great to see how the government is implementing so many things, but how is the public reaction to all those restrictions they now have? Because a lot, actually, all the countries are saying that you are not allowed to go out, and only it's essential for you, you should go, else you should stay at your homes. So how is the public dealing with this?
Okay, so actually today we had the curfew was from about 6 p.m. to 6 a.m. the next day. Today we had a new order by the government to have it from 3 p.m. to 6 a.m. next day, which is more confining. And that's actually a positive step because if you look at the China example, they did a full-on curfew, and after a few weeks, they managed to subside any cases of corona and have it under control. And that's where we want to go. We want to reach this controlled point. I think generally, from our point of view, Saudi is about 30 million or 35 million people, residents and citizens. And going back to the initial way of how Saudi was born, it was a lot of groups of people are united under one country. So this culture of the heritage of being a family, being able to communicate and understand each other, feeling the same or having the same stance in the situation exists, which is reflecting currently where if you go on social media, people are trying to enjoy their time at homes. They're doing Zoom family meetings. So such as what we're doing, they are opening Zoom and having families communicating with each other. They're playing a lot of board games online. We have a special game called Carom. It's like a billiards with your fingers. And a lot of people are starting to play it. We're going back to a more enjoy yourself outside life. And you see people communicating and trying to support each other in this situation, but you still have people that are irresponsible. You still have people that are going out. You still have people that are not communicating where they've been, or they've been having a positive or symptoms. You still have people that are not taking it seriously and having fun and joking about it. It happens everywhere, but I think we understand the seriousness, and that is just a minimal amount of time compared to how long we can be if we don't do these strict actions.
Yes, definitely. Thank you. Nali, what can you tell us about your government and how the government is dealing with the current situation? What measures are they taking?
As I said, they have taken strict measures, and I do appreciate the honesty and the transparency, as Hamad mentioned. That's a very critical point in regards of the communication in outbreaks, and we have been doing this, reporting every single case and every single positive test. In addition to this, response of people in the beginning, they were reluctant. They were not following the restrictions, but step by step, the number of cases increased. They got there was some sort of frightening, and then the government set penalties for those who were going out, and they increased the penalty the day after because there were still people who were going out, and they the curfew was only for about let's say from the from 1 a.m. to 7 a.m. That was the open hours, but they made it to 24 hours. So they imposed the further strong restrictions, and that helped in containing the virus more and more.
Okay,
Just,
and how are they're dealing with this, the restrictions, as I asked the same question Hamad right now?
Yeah, people are following the restrictions now. They are doing what the government is saying. But as Hamad said, there are still few people who, let's say, ignore those warnings that they still go out. But they are few.
Yeah, there are. I feel like what I have experienced here is definitely the government is doing and contributing to the current situation. They are taking all the necessary measures they have to, but there are still a lot of people. Means it's also a role from the public to actually contribute to the situation, because these little things like going out and like staying hygienic and all these things, they contribute actually to the current situation, could make it better or make it more acceptable for many people. But a lot of young people I have seen who think that they are not as much, would not have a huge impact by the virus as elder people have, still go out and don't follow the rules that have been implemented. So that's a bad thing. So apart from this, yeah.
Yeah, if I take this, Dr. Hamad is already here. He knows much better than me. But to clarify and give an example of how the social distancing is the key to lower the curve of the epidemic, the pandemic. Now, I would say we will take the Spanish flu of 1918 as an example. There was a state of St. Louis, which 2 days after its first case, they closed schools, playgrounds, libraries, courtrooms, and church, and they banned gatherings of more than 20 people. That's what I'm talking about in 1980 in the St. Louis. On the other hand, there was Philadelphia in Pennsylvania, which they ignored the warnings that influenza has spread among the soldiers who are coming back from Europe. So the people didn't listen to government, to the warnings. And what happened was a World War I support parade, like a gathering of a lot of people that attracted about 20,000 people. And after 3 days only, every bed of all 31 Philadelphia hospitals was filled with sick and dying patients. So if you compare both sides, both cities in one country of United States in 1918, you can see how social distancing was the key of preventing the widespread. And you mentioned the youth people who are, as I have seen as well, they are saying they are more resistant to the infection and they cannot die from the infection, or what else they are saying. Well, the problem is a bit of those claims are true, but let me tell you, youth are 10 times more active than olders, and that means they can infect 10 more people, specifically with mild or no symptoms, because they think that they are not having the virus. They may carry the virus and do not show the symptoms because their immune system is more competent, and that means they can. That doesn't mean they have to go out in public and visit their grandparents or friends, because they can infect more people, in fact. And that's the problem. Their beloved ones, those close ones, will be infected and they will suffer from the disease. And true, the good news about COVID-19 is that children and young people appear unlikely to develop serious symptoms But the bad news is that it appears that they can still carry the disease and pass it on to other people who have a much greater risk of dying from it. That's the problem.
Yes,
If I may add one also point.
Yeah.
Oh.
Hamad,
So,
would you like to into this?
excuse me?
Would you like to say something about social distancing and the people?
Yeah, so just to add on to what Nali said, looking back at different outbreaks and times, we did have the same types of decisions made about social distancing and curfews and stopping everyone from or limiting people coming in together to stop or limit the spread. But if you would actually think about it and take a step back, during our times as youth or currently the people mostly living this situation of the corona outbreak, we did not have a serious outbreak in our lifetime. We had a Ebola outbreak, which was a very serious outbreak, but was not very effective as corona or as the Spanish flu or as the measles.
Localized.
So exactly. So in our perspective, when we think of outbreak, we don't take it as seriously because we did not live through those times. And that's something we need to take into account because that's the base of education and knowledge and experience that's everyone in this world has. And we need to communicate and take action in that regard, not treat everyone at the point that they will understand that this outbreak is serious, but they would need to be guided. And which brings us to the public health. This is a public health issue, which means governments and entities need to draw this map of policies and pathways for people, but the people need to go through those pathways themselves. This hopefully will be done and is being done by multiple governments in multiple countries in the world. And we're seeing a positive outcome currently. If you took it seriously early on, had a decisive action, had proper honest communication and proper communication channels with the people in your country, you're doing well. If not, you're going to be doing well in the near future, inshallah.
Yeah, sure. I agree. I feel like people should be more aware of their responsibilities. And I also think to be aware of their responsibilities, they should have an idea about what is actually happening. And there is been a lot of awareness communicated to the people, but I don't want to say in a wrong way, but for the local people, like for people in Pakistan, it's impossible because all the information mostly is in the English language. So it is difficult for some people to understand and implement this. So what our hub is doing is we are getting the information from WHO or like other organizations and translating them into our local language Urdu and providing this to as many people as we can, like influencers, to post that on that information on their social medias. We ourselves post this on our social media. So how are you dealing with this, with communicating to the local people, to the common people? How do you explain them what is actually happening? Because a lot of people who are not educated as much have an issue with this regarding this point as well, like awareness. Yeah, Hamad, you can continue, then I'll go on to now.
Sure. So, and as I said, we had a proper communication channel through the Ministry of Health, and they reach a good amount of people in Saudi through social media and SMS messages, emails, on-ground campaigns before the curfew. On TV, they have a lot of commercials happening currently. So in our regard, as the Riyadh Hub, we decided to be more smart, and as other entities to be more to do what is more impactful. So what we're trying to do is actually take action in 3 different ways. One is having webinars such as this with our local youth to have more understanding, more discussion and education from different people and different aspects of the Saudi life, to give them a more base of understanding of the situation and how to deal with it and become more or activate them and activate their responsibility towards this outbreak. The second point is to have a more better communication of or to have more a youthful communication of what's happening, since from the awareness and proper techniques that need to be done through hygienic purposes and precaution purposes. And that we're doing, again, as you and other hubs are doing, we're compiling all these information into a Riyadh Hub information booklet, and we're giving it to those that need to be educated, or just would be more educated when they read this information. And finally, we're doing, and the Riyadh Hub is continuing our education, our activities, where we want to make sure that we are taking responsibility. We understand this very well, but at the same time, we're still moving on with our lives without having any hindering of productivity or efficiency. We still have the capabilities, and we're using it. The future is to utilize our IT infrastructure in the world. And we're basically doing such a initiative where we take Riyadh Hub online. So everything we've been doing on ground will be turned into online webinars and workshops to still give back and still have impact to our youth society in Saudi.
Okay, great. Great to see all these initiatives. Nali, what have you to say about like the communication? How are you providing awareness amongst your people in Iraq?
Yes, as a global shippers of Erbil Hub, first of all, we have postponed some activities that we were about to held in March amid the outbreak of the coronavirus and the risk of spread among the people. So we followed the restrictions of the government and canceled and postponed the conference for the cancer patients and other activities. Instead of this, we felt responsible and we wanted to do something online. So what we did, like the other hubs, we tried to do some myth busting, like the false information that is out there, and to convert it into and to translate it to Kurdish local language and share it among the public. What are the facts regarding the outbreak? But because we could see some people are using antibiotics themselves. Some people they were eating garlic. Some people were they were following a lot of false and scientific things that were not facts, and they were not helping at all. And I want to say here as well to public that they don't have to self-medicate with OTCs and prescription-only medicines by themselves unless they contact a healthcare provider, because that's very dangerous and it has a lot of interactions. Because I see people nowadays, because they read online, and when they see some medications have been used somewhere in a research, in an experiment, they try to buy it and use it themselves. For example, the azithromycin and the hydroxychloroquine, which have drug interactions. They shouldn't be used without any healthcare providers. In addition to this, we are planning to publish like a daily routine schedule to stay productive at home, so that you don't waste your time just sleeping and just like getting yourself busy at home, but to set a daily routine of how to stay productive. We have a peer support community of the hub, so that we between each other stay connected and share the anxieties we have, talk about the situation, and talk about how we spend our time between ourselves as the hub. And lastly, but not the least, two of our shapers, myself and other shaper, a medic from a medical background. There is a hotline government has set. I forget to mention that. There's a hotline the government has set for public, so that they can contact the hotline free of charge and ask about any question they have about coronavirus, and they will receive instructions. Me and my friend from the hub are online receiving calls and are doing shifts so that we can help public through this hotline as well.
Wow, great. This is a lot of things your hub is doing, and I really like to see, I'm really glad that the hubs are taking so many steps regarding this current issue. And a lot of the what I feel like common thing the hubs are doing is translating that awareness messages into the local languages so people understand
Exactly.
them better. I also, when yesterday was talking to Cape Town Hub, she told me that they are doing the same thing. They're making it easier, the messages, not as much technical as they are. So this is a great thing too. Yeah, and we are a
And
pretty, yeah, you say?
yeah, I'm sorry, but I just want to highlight 3 points that we as Yank, every Yank can do and shall do in response to this outbreak. And first of all, as you mentioned, being informed, stay informed, and ensuring others what to do is the key. That's the first point, because accurate science communication is the key in the fight of the coronavirus. And the second point I want to mention is to take action to keep your community safe. That's to share information, to translate into local language, and that's what we have been doing, like many of other hubs. And thirdly, I think if you could speak up to ensure your organization does the right thing. For example, even if you are not working in a private company, even if you are at home, you can encourage your home to take precautions to disinfect the areas. If you are working in a business and your business is still running, you can ensure spaces are clean and hygienic. You can promote regular hand washing. You can test remote working and communicate it clearly to the employees, to other employees. I think those 3 points are very important to be taken, and they are very easy as Yank as a response to the fight of this pandemic.
I'm sure definitely everyone would agree with these 3 points. And yeah, they are definitely really, really important, and people should look forward to implement them into their daily routines and try to encourage other people to do the same thing. This is really important because I think it's really, really important that we support each other. And yes, for sure. So, can you tell me how the current situation had an impact on your daily lifestyle, on your anything what you were doing, how things have changed? Nali, you can
Yeah,
continue.
yes. I was studying in the capital and having a part-time job in a pharmaceutical company in the capital of Kurdistan, Erbil. But the day I came back to my hometown, supposedly for 2 days, but that lasted till today because the lockdown started. And on the positive side, that I'm enjoying my time with my family. I really enjoy that. I have plenty of time in the world to do what I couldn't do because of my busy schedule now. So I watch movies, I read a lot of articles, and I have my final exams upcoming. I don't know when, but I really have to study, even though I have lost the motive, honestly now. But I'll try to keep that one too. So uh, I can say the schedule of my life, the daily routine is upside down now. I'm trying to maintain it. I'm waking up every day at the same time. I'm going to sleep at the same time, so that I keep a work my schedule, my previous routine. I have separated my area of working, of studying, from my bed.
Mhm.
Like I'm not studying on my sofa or on my bed because like I feel sleepy. So that and I recommend everyone to do that so that they have a routine in their life. That's what I've basically been doing so far.
Ah, great, great to know how we all are utilizing now the time that we have. We never had spare, now we have spare time. So I would like to know, Hamid, what you do. How did the
Oh,
entire situation had an impact on your life, and how are you
mm.
dealing with it?
So yeah, coming from a medical background such as Natalie, we do have a lot of time to watch movies right now, and we have a lot of time to read and sleep. So
I can relate.
this this made us no, so we, I think people in the medical sector are experiencing this differently. I am a medical doctor, but being a neurologist, I'm not exposed to a lot of corona cases or the need to be on the field as opposed to others. But I still do my daily job. I uh, on attending not as much because they had a new policy where one physician would be attending per day, per week. So the time in the hospital is less, but there's also a lot of initiatives taken to support the efforts for the COVID-19. So, you know, there's a need for resources. So we are, as medical staff, resources to communicate through hotlines such as what Nali's doing. We have our own 937 hotline for any medical questions. And of course, to be on-hand support for any issues where there needs to be further screening and further, let's say, on-ground support to screen people in grocery stores or those who need to be in hospitals. It's between being at home and doing my job and also trying to be part of the resource supporting COVID. But 80% would be more of a being at home with my family, having fun, playing board games, trying to catch up on sleep and movies. And of course, you have a lot of free time to actually do what you need to finish. If you need to finish your resources, if you need to finish some courses to develop yourself. And finally, we're having fun doing some brainstorming initiatives with the Riyadh Hub to try to be part of the youth action towards educating and taking action during this time of COVID through the Riyadh Hub for the Saudi youth population.
Okay, good. Okay, I have a question to you, Hamad, from Riyadh Hub. In Saudi Arabia, like apart from Saudi Arabia, a lot of holy places have been closed, mosques, churches, temples, everything, because obviously you should go for social distancing. So in regarding this situation, they have been closed, shut down. So amongst these, the Kaaba, the mosque, the Holy Mosque had been closed. So when we got to know, the people in Pakistan got to know about that, they got pretty sad. And I think there's no word actually that I can say right now for the situation. So what was the response? How reacted the people in Saudi Arabia to the measure was taken?
So I think whatever sadness happened outside of Saudi, it was amplified maybe 10 times in Saudi. It's not just a place of worship, but it's also a responsibility that we've taken. It's like a host that is always ready to invite people of the world to join and welcome them. Now we don't have a place to welcome. We don't have the opportunity to welcome everyone, and we also don't have the opportunity to visit these places. It recently actually just closed, but in the beginning of the COVID outbreak, when it was more controlled, there was a action taken to actually, especially in the two holy mosques, to kind of like constrict or limit the areas. So there was a minor opening of those areas, and it was continuously maybe 7 times disinfected to prevent any outbreaks. But then soon after, it became out of hand. And as you know, in Italy, I think there was one man who was positive for COVID or was having symptoms. He went into a church, and a few days later, about 500 people got infected. There was a politician in Bahrain where he had a positive symptom, and that occurred later on. He didn't know, and he quarantined himself after he was positive, or he had some symptoms. But before that, he was with people having some contacts, and he was basically number 215, and because of him, there was about 30-40 cases. Gatherings, whatever they may be, need to be closed off, so we may have them open later on. It's a difficult decision, it's a difficult situation. But and I saw some reactions here in more of a local presence. We still have the imams going to the mosques, to the masjids, and doing the call to prayer. And some families actually in Riyadh would take out especially in Saudi, where a lot of families like to live together. So you have a lot of people in one house. So they would change up one room of their house to make it a masjid for the family. So they have enough people to make their own call to prayer and their own jama'ah or group prayer together. So it's kind of adapting until the situation occurs. It is a necessity that we sadly have to take, but hopefully very soon we'll welcome the world and we'll see everyone and we'll have a beautiful time together, worshiping and coming together.
Yeah, sure. Thank you. Naomi, what can you tell us about how it is being dealt there in Iraq with those holy places?
With the religious places, you mean?
Yes, mosques, churches, temples.
Yes. Well, they closed every mosques and masjids, and they banned gatherings of the people in the masjid for Friday prayers and for the other prayers. It's only call for prayers that's happening now. When Imam, when the one who leads the prayers tested positive, and unfortunately he died out of the virus. And after that, the restrictions got much more restricted, and this man infected 11 other people with himself because he had no symptoms and he was having the virus, and he led a prayer. He was an imam in a mosque, and he infected the other prayers that were in the hospital. So after that, the restrictions got better, and until now, all of the mosques and masjids are closed. At the beginning, the religious people, and they thought that this is not necessary. They were gathering in front of the masjid, even though closed. They were trying to do their prayers in front of the masjid. They were like announcing it to public that we're gonna hold a Friday prayer in that location, that specific location. They were attracting a lot of more people, but that got stopped as well, and they have punished and they have given ticket to those people who led those kind of gatherings as well. So now the situation is under control, and no one is going to masjids or churches as well.
Okay, good. It's definitely at that time, and really hoping that this gets over soon. So, can you tell me something about the economy? How is it like? Is it still working the same way? Obviously, there have been some changes observed. So, can you tell me about the impact of the virus on the economy in Iraq?
Yeah, well, if I talk about the economy on global level, most people see the COVID-19 as an economic crisis first, health risk second. That's on global level, and that's been reported in the surveys, and it's a much great concern of people worldwide. Locally, on country level, before those outbreak, there were demonstrations of people for the economic crisis of the country in the central and southern part of Iraq. And now, as Iraq is undergoing, as Iraq is heavily reliant on income from its oil, and that the price of oil has now dropped. Furthermore, this means we will suffer more from the economy. That's on country level. And then on individual level, those people whose income was on daily work are now in desperate need of money. Though unsurprisingly, many generous and wealthy people, along with NGOs, are delivering food and supplies to all families in need. They have phone numbers that you can reach out to if you need to, and it's very human, I think. Even those people, and even those people and those wealthy people have helped the government and donated money to build several hospitals in the region designed for the COVID-19 patients.
Good. Hama, what's the situation there? How is the economy in Saudi?
So first of all, and I hope, again, echoing what Ali said, the economy is being disrupted globally. I really hope all our friends are having a smooth transition into a more stable economy during this crisis. We're just looking at a step back. A lot of world leaders already discussed that 2020 would be a year of economical instability. And subhanAllah, we had this COVID on top of all this economic instability. So it's a double blow for everyone. So on top of that, we also have the oil situation happening as well. So there's a lot of contributing factors to the stability of our economy in the world. Currently, what's happening in Saudi itself is, again, as I mentioned before, that there's a 120 billion dollar real fund to stabilize our internal economy. And there's the funds of different areas of government are all being redistributed in a way to be more smart in the situation, roughly in 3 areas. One, to more support the Ministry of Health efforts to stabilize or to control the situation of the COVID-19. Second would be in the area of the Ministry of Commerce to stabilize the market, support the small and medium enterprises as they are more of what keeps our economy stable. These are the businesses that every day are creating an inflow of money in and outside of Saudi. Finally, there's this Ministry of Finance effort in specific to continually discuss and to take action. Again, today we had the G20 summit, virtual summit with the G20 finance ministers and as well as the bank governors to understand what's the situation that's happening, how we're going to manage the coming impacts and how we're going to stabilize the whole market in the world, not just internally. Again, we need to think about the neighbors, about the whole global economy in the areas of the big players such as China and the US. These decisions also need to be put on the table. But I think hopefully it's going well and is slowly becoming a positive outcome rather than decreasing into a more worse situation. Thankfully, we don't have a lot of issues with jobs as there are strict government rules to not have any jobs, people laying off of jobs. There's also strict rules from the government to not raise any prices of daily use items to take advantage of the situation. And there's also stimulus packages for citizens to give them the support they need to fight off this economic situation. Finally, there's also a private sector and profit sector support where they're doing their own initiatives to stop any need of payment for the next 3 months. So if I own a building with 5 or 10 companies that are in that building, I'm not going to ask you for rent for the next 3 months. And that also to help carry on the existence of these companies in the next 3 months. So it's about keeping the jobs. It's about stabilizing the current businesses so they do not disappear. And it's also about stabilizing the flow of income or the flow of cash inside the country. If there's a lot of price changes, the inflow of money will not be as smooth, and it's going to hurt the economy also on the long term. But on a positive note, just to end, stocks is always the stocks and oil prices are always a good measure of looking at the economy. And thankfully, in the last 3 days, a lot of US stocks, a lot of stocks in Saudi and other parts of the world are becoming green. Price of oil is slowly becoming to rise back up in a very small increment, but that's also echoing what's happening with the discussions on the Russian table of oil companies. So again, that's why I'm saying that we're not going down, but we're slowly but positively going up into a more stabilized market, hopefully in the next month, not 3 months.
Yeah, sure. There have been in this scenario kind of a negative impact on the overall economy everywhere around the world. But I'm really glad to see how those people, those local people who can afford are supporting, are sponsoring those people who cannot, funding them, is it through providing them the money or providing them those essential needs. So yes, it's great to see that. So apart from that, can you tell me something about the impact on the education system? Because we are seeing a lot of people, apart from the employment sector, are switching from those going to the institutes, going to their offices, to the virtual platform where they can take those online classes. They do the meetings through apps like Zoom. How are the people dealing with this? Because in some places it is not a norm to communicate this way. So how is it in Serbia, and how are people doing this?
Okay, so I structure my answer in three aspects, which is the infrastructure that already existed, the situation that arose, and let's start with these 2 points. So actually, there was a lot of educational institute that actually started right off the bat in the next week. They didn't need to create or manage or create this new policy or pathway for online education. A lot of schools already had this online platform set up, so they didn't need to do much work. They just communicate to the students that there's not going to be school for this week, and starting from next week, we're going to take our classes online. And that helped sufficiently to not hinder the progress of education. The second thing about the infrastructure was there, but I would say in about 20%, not the 80%. The second part of the current situation that arose, we understood that there was not a proper infrastructure for online education, and we actually try to do that in a very fast pace to again give the proper necessities. So what we discovered is that there are a number of people that did not own the computers or the tools or the technology and the internet connections to study or be part of this continuity of education. And the Ministry of Information Technology created this initiative called Ata, or to give, and it actually looked at private sector more than the public to donate new computers and systems and laptops to families that need a source of internet connection. It also made a new government rule for the or actually, again, the private sector on the aspect of the telecom companies also did their part by giving free internet access to those who are going onto those education platforms. You don't need to have a internet subscription to go and continue your studying. And finally, to look at all ways of giving education, the TV channel called the Ilm, or Education, has continuous lessons being broadcasted live to anyone with the TV channel, alhamdulillah. Recently, 2 days ago, the Minister of Education came on online with a speech about the current situation, and he said that we will still carry on with our school plans, continuing with an online education. There will be no return to schools because of the situation of contamination and precautions, but we will still be having online examinations by the end of the year. A lot of people thought that this is going to be switched to online projects or online ways of grading people that are not examinations. But for one, I think this is a positive way of looking at it. If you did not say that the examinations are going to be discontinued, a lot of people are not going to feel the need or the urge to study, not because of the education system, but more about the internal urge to study and be educated. We live in, and that's on a global level, we live in a world where if you want to study, you have to go through this education system. You need to go to school, you need to go to homeroom, you need to go to a study group. Internally, there's no proper motivation to study. So in order to reach that future where we want, where people are having continuous education and having free, easy access to online education, we need to kind of like give a strong push for the young ones currently. So his statement is very important. I think that examinations are still going to be there, so people still need to study regardless of what's the situation. Education is a priority, and I think what the Minister of Education is doing is very impressive, and having prompt, decisive communication and action towards the education situation with the crisis.
Yeah, I can relate totally because I am currently not studying because I don't know if I'm gonna have an exam or not. So it's just like it's completely unclear because if I don't know if there's gonna be an output, why should I be doing some input? Like, you know?
Makes sense.
So yeah, I can understand your point, and we should definitely work on this too because currently people are working on the environment, on how to tackle the virus, on how to sustain the economy. But about education, there's just the online classes have started, but like we don't see some goal, some objective towards what are we working in the education right now. So, Nali, what's your opinion about this education? Because you are studying yourself too. So, are you like me? Are you not studying right now, or what are you doing?
Yeah, well, as he said, education is top priority, and in my country, education is now paralyzed, and that's a bit worrying because we do not exactly know when life gets back to track. Children have children can get lost uh, with their iPads and TVs. If parents are not concerned about that. But the Ministry of Education came on TV and reassured that the academic year will not be cancelled. We will still be going on. We this this outbreak is a lesson for us. We can all learn from it because we knew that there is no infrastructure for online teaching because only some private institutions were having online platforms for the students and they were not functional. So with this outbreak, as the education paralyzed, we didn't know what to do. So education stopped. But now, in the last week, there has been the private institutions are going online. There has been developing of platforms for students to restart their academic year and to finish what's left on their curriculum. So this as well, if the online system is available, the kids will know that their iPads are not only for playing games, they can use it for learning as well, for continuing to school. And this outbreak, it's not only about outbreaks, because sometimes there might be other global challenges that might restrict our movement to schools. So the online system is not only outbreaks, and we can use it for as an alternative for the classical teaching for other challenges that we may face in the future. So that's the education. That's how the situation is. So the education is paralyzed on one hand, and this paralyzation is like an issue that we can learn from. It's a lesson that we can take advantage of. We can resume the studies, and then for the future challenges, we can be prepared more.
Exactly. Yes, definitely. I also think like it's really new because like Hamad said before, we never experienced something like this. Our generation at least did not. So there are some loopholes we have to work on them, like the education system right now. I mean, the classes, the online classes, they have begun, the seminars, but where are we leading to? Like, what is the result? How are we going to take our exams? And then yeah, so that's a major point. So how you think this will impact our future, Nali? You can continue like with all these current situations, things are changing, we are switching more to those online platforms. You think these things will be will be like this in future too? Like people will prefer more the virtual platforms than going out? Like, will you think this will have an impact on the future after the coronavirus hopefully ended?
Well, that's a very interesting question, because how is life gonna be after the lockdown, the restrictions, the curfews of the outbreak? That's an issue currently, but we can't be sure 100% of what we say. But I would say slowly, and I hope for a slow transition from the outbreak to post-outbreak period, to restart what has been destroyed. And I think this outbreak, uh, like we didn't expect it. We were expecting, for example, another world war. We were expecting a nuclear weapon. We were expecting some other challenges that may hit us, but out of the sudden, the challenge of an outbreak came into the way. So what needs to be done, and what I'm hoping for, is challenge can teach us to be more prepared for the other outbreaks or other challenges that might be in the future. Uh, that's what I can say for the future, and I hope everything goes as smoothly and seamlessly as possible.
Yeah, I really, really hope so too. Okay, I guess Hamad just disappeared. I think he will be back in a while.
Yep.
Okay, so what do you think? How can we, because we are taking measures, the government is taking measures, people are trying to impose those measures too in their homes. They're trying to encourage the people they surround or they have an impact on. But how do you think, like, we on a global basis can support each other?
I'm sorry, but can you repeat the question? I couldn't hear that.
Yeah, I'm asking like how can we on a global basis support each other? We are having these webinars, these
Yes.
live sessions, talk about like what we feel and what is happening, and we get a knowledge of ourselves about the other countries, like you were telling me about Iraq. So, but
Yes.
how can we support it? Like, what can we do actually? Do you have any ideas?
Yes. Yes. Apart from what you said, that the communication between the countries is very highly important, so that we know what's happening in other parts of the world. That's the first, to be informed and to be out in public and inform others. What can we do? Uh, and as you know, the Sustainable Development Goals, one of them is partnership, and we have to revitalize this global partnership to better fight the challenges that we have. As Hamad said, that their government has donated a lot of money to WHO. That's a very nice step forward to helping and to help other countries as well, because you may have the resources, you may have the capability to fight the coronavirus, but there might be other countries who have a undeveloped and underinvested infrastructure or health structure that might not uh, stay with this outbreak. It might collapse. So helping those countries in need and trying to reach your hands to either financially or either sending teams, for example, like what happened in Ebola. There were a lot of teams sending from other countries that they were experts of the communication diseases, of communicable diseases. They were experts of epidemiology. And like what China is doing currently nowadays, they are sending equipment and facilities to every other country, like masks, like gloves, like the testing kits of coronavirus. They are sending experts to manage the patients. That's what that's what the global support and global partnership is about. And I think those examples can be replicated, can be adopted to help every other country.
Okay, and what is your hub looking forward to? You told us a bit about what you currently are doing as a hub, and you have any future projects regarding this? Can you tell us about them a bit?
Yes, we are about to develop such a digital platform that we the hub members and the other young people who would like to join to have some sort of online club that we can all, for example, raise an issue, for example, talk about fashion industry, and then everyone shall comment on what's about. We will talk about, we will watch a documentary or watch a movie, then we're gonna discuss it. We will choose a book, and then we will have a discussion about the book. So like an online club, we are planning to develop so that the people know how to like stay productive online and at their homes.
Yeah, that's great. I'm seeing a lot of initiatives by a lot of hubs all around the world. So our hub itself, it took the initiative to produce like 50,000 hand sanitizers because it is a huge shortage here right now on mask and on hand sanitizers. So we did produce them, and in association with like local support, we did it, and it was according to the WHO formula that was provided. They were produced. We had a bit of obstacles like bottles, so we don't have any more bottles because we are still producing them. We're providing them to the public free of cost. But hopefully those little things, those obstacles go away and we can continue doing these things. And like you said, we are also trying to establish a platform or will organize webinars with some of our hub members who will conduct them to provide knowledge and tell people how to deal in these situations and do question and answer sessions or similar things to regarding this. So it is, I think, really important that we cope with the people and show them actually we are there and support them in various ways we can actually. So yeah, that's great. And I'm looking forward to Hamad, but he's gone. So is there anything special you would like to say to the people? Because you are right now just not only talking to your people or to my people, there are a lot of more viewers there. So you have a specific message you would like to convey to the people right now?
Not to interrupt, but I'm also online, back online. Sorry for the quick loss of connection.
Okay.
Yeah, I'm telling everyone to, this is, we have to have ethics. There is something called emergency ethics, and that's sometimes we have to let's say put aside our individual interests aside, and we have to take each other's hands and take action, because in this very fragile situation, very sensitive situation, if we do not hold hands, we're gonna collapse. There are some hard choices for people to make. They have to balance rights and duties. We are demanding exceptional tasks from people. What is it? What it's all about is to have the curve, because you do not have to, for example, as Hamad said, we do not want to people die of poverty because they are living in a house which is for rent. You can just close your eyes and do not want that money for 3 months of rent, and you can help the people. So that's first, to feel responsible, everyone on their hand, and help each other and take each other's hand. On the other hand, I'm telling people to listen to what the health authorities are telling you, because what they say is for your best interest, because it's for your health, and that's how the issue is gonna be controlled. So I'm advising them not to follow unscientific methods of healing, to listen to the authorities, and to do what's the best for their health and for the others.
I understand it. It's great. And Hamad, are you still with us? I can't see.
Yes, this is the video on.
Yeah, okay, I can see you right now.
Okay.
Okay. So I asked Nali, and I'm asking you again. What do you think? How can we support each other? Like, due to we are like far away from each other. Still, we are communicating through this platform. term. So are there any other ways we can support each other, like in this crucial time? How you think we can do
Okay.
that?
So very beautiful words by Nali. Description about the partnerships and being collaborating together, holding hands in this situation. I think right now with the current situation, uh, we still have the ability to communicate. We still have the ability to work together in the areas of awareness and the proper ways of communicating to our societies. We can learn from what each one is doing. So the example of how the World Health Organization gave everyone the formula to create their own hand sanitizers. A lot of countries are doing so. A lot of countries don't understand the methodology or the preparedness to do it. So if we share these practices, if we share our experiences with the other countries, we'll be able to give them insight on what they may be able to do. As small as it is the step to create hand sanitizers and distribute them in regards to a big crisis. This is something that needs to be done by everyone. Looking at the example of the drive-throughs by South Korea, by the US, by Saudi, is also a good example to share so people can take it into account and become more of a knowledge sharing process. I think also we need to also advocate about how this crisis is a need for more resources, manpower, and the medical resources. We need to advocate about how our countries are giving us the ability to contribute to this crisis, such as what Nali said, that they're creating this hotline and allowing anyone with experience or a medical background to speak and answer questions. This is it's a necessary step to be done. And again, a very simple step to be done if we have the proper infrastructure. If we communicate these ideas, we are able to elevate everyone to the right position. So it's mainly about giving the proper awareness and sharing our experiences. The medical field on its own is sharing their breakthroughs and their reports and their managements of how they're controlling this disease progression in the individual. We're communicating and sharing our progress and how we're dealing with the control of this crisis. Finally, I think we also need to be very well aware about what we're doing currently. And we as Riyadh Shapers or any other type of youth leaders or youth groups are initially social leaders in our societies. And we need to be properly documenting what's happening currently. We need to be understanding the value of the communication between our youth groups on social networks. We need to understand the different methodologies each country did individually and as a practical way for their specific environment and their specific culture. And grouping this together and creating it as recommendations by the youth for the future. Sadly, this is not going to be the last outbreak we have. We're going to have much more outbreaks soon. We're going to have a climate crisis. We're going to have an economic crisis. We're going to have more diseases coming up. And if we do not use and activate our role as social leaders in our societies, especially as youth, and not document what we're doing, not distributing our knowledge between each other, we're not going into decision makers, sitting on the table, telling them what we learned, what we contributed, what we're aware of as youth. We make up about 70 to 80% of the world population. It's our time to do our impact, and we can, whatever we as youth have 10 times the ability to do what others cannot do because of time, because of energy, because of opportunities. So I think, just again, to summarize, we need to have proper awareness on a global level. What we are learning, we need everyone to learn. With the initiative of translation, that's a very beautiful way of doing it. We need to be communicating our ideas and our initiatives, such as the hotline initiative, the drive-through initiative, and what other initiatives that are happening. If maybe someone online just heard the initiative to distribute electronic equipment to low socioeconomic neighborhoods for those who need to continue their education, that can be implemented right away. People are very generous all over the world. And finally, we need to document what we're doing and present it to decision makers, because when hopefully we come out of this crisis, we need to have a shift in how we deal with these crises. We need to have a shift in our education system. We need to have a shift in our health systems, and we need to have a shift in how we're managing our economies and our finances. But most importantly, we need to have a shift in our culture, in our societies. And that's not going to happen unless the major group of society, which is the youth, start taking action and start communicating their responsibility to become a more culturally or to have this paradigm shift in their own societies.
Yeah, for sure. I agree with both of you, and it is of huge importance that we get aware of our responsibilities, especially young people in our generation have so much more powers. We have globalization, we can connect all around the world that was not able for the generations before us, and we should use it in a positive way, and we should make some change and contribute to shaping our future, what we hopefully will do. So, Hamad, I have a last question for you. You, as a doctor, how are you experiencing the COVID-19? And would you have some suggestions for the people watching us right now? What can you say as some wise words how to stay safe?
So I'll speak to the public, and then I'll speak to the medical professionals. For the public, I need you to be very careful. I need you to be very, you need to be a very good listener. Try not to take any actions that are, that might put you or anyone you love in harm's way. Just please be be a very good listener to your health entities that are telling you what to do and how to do it. When we say something, we really mean it. If you're going to wash your hands, please do wash your hands for about 40 seconds with soap, or 20 seconds with the hand sanitizer. Make sure you never touch your face, because even if corona is literally on your hands, it will never infect you unless you touch your face. That's something that to simplify the infection process. Please also be, I know a lot of people are saying social distancing, but it's also about contact distancing. Please always have about 1.8 meters between you or anyone else, especially in your house, because you never know when someone might have brought something, especially if you have a doctor in the house. They might be going back and forth. They have their watches, they have their phones, might be a source of infection. And please listen, because as we said, the more we contribute, the less time we're going to be in this quarantine and in this health crisis. And you can look at China we can look at China with a good example. They stopped having any positive cases because of what their measures, and because society did their responsibility to listen and advocate. And if you really look at it, everything that's being done as a precaution is harming us on the long term. So the more we stay this way, the more harm we give to our education system, our health systems. Resources will be depleted. Our economy is going to be very difficult to kind of bring it back up. So we need to listen and be responsible in order to lessen the impact on the future. For the medical professionals, I would really appreciate if you also be a good listener to the protocols of the hospital. You need to know where you stand. Don't see or do much unless it's very necessary, because you are the main source of infection in the hospital. You're the mobilization part of the hospital. The patients are staying where they are, the equipments are staying where they are, but you're mobilizing all around the hospital. You're communicating with other doctors in different places, different wards, different patients, different levels of contact. So if you go to your work, make sure you know why you're going. Don't go if you don't have anything you need to be doing. Some areas of the world, they need everyone on board. Some areas of the world, they need just the people on ground, on board. And whenever necessary, others will join the healthcare field. Go without anything, no watches, no rings. If you need to go with your phone, and use a separate cover. Take the cover off before you come back at home, so the infection stays. If there's an infection on the phone, it stays on the cover rather than on the phone. Disinfect everything before you come into the house. I personally, everything I have is kept in the car, and I go in and I instantly shower and I disinfect everything before I go into a further step to say hi to my family. And finally, it's about supporting those who really need the support. It's about the mental health and the appreciation to those who are actually in the front line, the emergency physician doctors, the emergency medicine doctors, the intensive care unit doctors, and the infectious control doctors. I'm a neurologist, but I'm not doing as much as what they're doing. They're constantly, some people are not living with their families anymore. Some people are in the hospital, sitting in the on-call rooms. They are continuously assessing their patient. They're continuously reading the literature, communicating with the doctors. We're in a calm situation. We're just sitting at home. We're trying to go through this process, but they're actively putting effort. They're actively becoming very tired, very exhausted. And that's why we need to be, as a medical community and as also as a society, to support their efforts. We need to make sure they have proper mental health care. We need to make sure they have proper appreciation. And finally, we need to be very smart in how we approach our hospitals. As a final note, please don't use any equipment that you don't need. Resources are very vital, because even if you have a country that has a lot of resources, you are at the end of the day wasting money and wasting resources. You're wasting resources that the medical doctors need. Don't use a mask if you don't need to use a mask, because you're basically stopping the spread of anything from your mouth to the outside world. If you don't have anything, if you're not affected, you don't need to stop anything. If you don't need to wear gloves, don't wear gloves. You don't need to wear gloves to go outside of the house. Just wash your hands. You're actually making more of an infectious process in the gloves and in the mask if you wear it outside. And please leave it to those who need it, which is the medical professionals. Finally, I think just let's have a proper mental support for everyone. This is a very weird shift that we had very instantly, and everyone needs to be social. The social aspect of life is very important for our mental health, and it's disappeared suddenly. So we need to have a lot of group talks. If you want to have family gatherings, please do a Zoom family gathering. Don't cut off social ties. Be distant. Don't be in contact, but please still go on Zoom, call your family, call your friends. If you have friends who are doctors, please call them, appreciate what they're doing. Let them talk about what they're doing. Let them talk about their days. Sometimes they don't need to really keep it inside. It's very important to keep the momentum of what they're doing still going. And I hope everyone is doing very well and taking precautions. And hopefully we'll have a very nice discussion live together very soon.
Great. That's amazing, and definitely we would like to thank all the doctors and nurses, all the medical staff who is right now working hard, because everyone has shifted to their home places. But these people, you are the only people who are actually working actively, and it's huge. It's a huge thing. You literally are the heroes right now. So yeah, I think that's it for today, and I would like to thank both of you gentlemen to be here today with me and talking about this topic. I hope we can make a bit of difference with this. And yeah, I hope it was informative for the people watching us. And yes, I will definitely stay in touch with you and get updated. And if necessary, we will have another live session if interested. And that's it from my side. Thank you so much for joining us.
Thank you, everyone. It was a very pleasure to be with you tonight.
Thank you.
Have a nice day.
Everyone. Thank you very much.
Bye.
Bye.